Abdurrahman Dahir Gutale often brings a family member to this mental health center. He says his relative's health deteriorated and he suddenly turned violent. The family is worried he could possibly harm others and sought help.
He lost his appetite, struggled with sleep and started fighting. He became a danger to himself and others. He was stressed and he had difficulties in his life.
The fact that Gutale's family sought help is rare in a country where discussing mental health issues is often seen as taboo. Dr. Liban Mohammed Omar, who runs the center, says there are cultural norms that make treatment difficult. In most cases, loved ones speak for the patients through relatives out of respect, but the most difficult hurdle is the perception of the problem.
There is stigma. People are too reserved to talk to you honestly about their condition. Therefore, stigma exacerbates the condition.
The Gutale family story is not an isolated case. As a result of over 30 years of war, Somalis have wounds both visible and invisible. A first ever epidemiological study on mental health in the country, the study says nearly 77% of the population in Somalia has a mental or psychological disorder, higher than previous studies had suggested. The study by the UN, Somalia's Health Ministry, and the National University found that the prevalence of mental disorders among the young is significantly higher.
Interestingly, what we have seen, these young people who are suffering from mental health disorder have also high burden of substance abuse. And this has been scientifically proven that these are correlated.
Mali called on the community to reach out for help and treat those suffering with compassion.
So there is a lot of work that we need to do at the community level to raise the awareness of the people that these are their sons, these are their daughters, these are their own family members.
Lack of awareness also plays a part, Omar says.
The majority of patients have little or no knowledge about mental health illnesses. Now, we are increasing our efforts toward creating awareness of mental health.
As for the Gutale family, they say their efforts are paying off.
We started seeing a change when he received treatment. He slept after a long time and became calm. It allowed for his caretakers to get some breaks, and he's now on his way to recovery.
The study, conducted between October 25 and November 15, 2021, also recommended training frontline healthcare workers, increasing awareness, and routine screening for mental disorders at the primary healthcare level. For Abdulkadir, Zubeyr, and Harun Maruf, Salem Solomon, VOA News.